I know many, many people who've struggled with their weight for a very long time. A lot of male friends, some female friends, who when they adopt a diet of the following things: meat, fish, eggs, Parmesan cheese as the only category of dairy, so hard cheese, fruit and vegetables, olive oil, butter, coffee, tea, fine, but no sodas or anything except diet sodas. They lose significant amounts of body fat, probably some water too. So they're not eating any starches, no rice, no oatmeal, no bread, no pizza, nothing. But they have all managed, this is anecdote, but they've all managed to lose anywhere from 25 to 50 or even 60 pounds. They're exercising typically, sometimes just cardio. So significant amounts of body weight, and they keep it off. And a number of their health challenges seem to resolve themselves, perhaps secondarily to the weight loss. But I often wonder whether or not this quote unquote, what some people call a low inflammation diet, because there's so few processed and highly processed foods in this regimen, has additional benefits that start to synergize with the fat loss. And it's remarkable how much better they look, how much better they feel, and they can maintain that pretty well. Because you can say, I'll pass on the bread and the pie, but I'm going to have double serving of turkey and Brussels sprouts. And it's kind of remarkable what can be accomplished with what I just described. And yet I don't know a name for that diet. And it's not it's not what I follow. I eat starches. But what are your thoughts on inflammation and how certain macronutrient profiles perhaps are pro-inflammatory or anti-inflammatory, or something people rarely talk about, which is inflammatory neutral, kind of keep you in a neither high nor low inflammation state, but just kind of a normal fluctuations in inflammation? Long question, but I feel like it's one I've wanted to ask for a while, and you're the guy to ask.
Okay, so I'm going to speculate a little bit. I think that any diet that facilitates substantial fat loss is going to lower the amount of inflammatory cytokines circulating and emanating from the adipose tissue. And so if you can get that body fat down, then you can get chronic low-grade inflammation down. If that body fat is reduced from everywhere, the subcutaneous space, especially the visceral space, then you're going to do a lot of good things for long-term health. The reason why the diet that you described is so effective at this is because it lacks hyperpalatability. And so the way that you create hyperpalatability is basically the tendency for food to be very flavorful, very delicious, and very easy to passively overconsume. And so the formula for hyperpalatability is basically refined carbs, fat, mixed together, salt it, and or make it sweet. And there's your formula for food that is easily passively overconsumed. And the diet that you described doesn't have these ultra-processed, highly engineered fat, carb, refined carb and fat combo foods that we are just kind of driven to just inhale down. And so I think that my view could possibly be a little bit too simplistic, but I think the inflammation issue is really tied to an excess body fat issue.
I've seen so many friends now lose significant amounts of body fat and stick with this diet. It's also one that if one were to have a slice of cake or a piece of pizza, you're not really deviating that far from the total contour of the nutritional plan. It's not like you're suddenly out of keto or something. And they don't tend to cascade into binges and things of that sort. I will say that most of these people also quit drinking alcohol at the same time, which probably has its own benefits. We'll return to alcohol a little bit later.
And there are some nutrients that are directly anti-inflammatory, like omega-3 fatty acids. Huge literature on their anti-inflammatory effects.
Do you supplement with those personally?
I do.
You take fish oil?
I do. And I know that there is some controversy and some infighting with the idea of supplementing with fish oil. Now people are afraid of atrial fibrillation and things like that. But, I've been doing it. And if you look at the literature, especially the randomized control trials, It is mostly good stuff, man. I mean, you can find negative literature on almost anything that you do.
Sure.
But on balance, I am still comfortable with supplementing with fish oil at this point in time, regardless of the mounting evidence that, oh, it might not do anything, or, oh, it might have this or that potentially adverse effect. I kind of think it's a no-brainer if you're not somebody who eats fatty fish regularly through the week.
Mm-hmm. Yeah, the high-quality sources of fatty fish tend to be very expensive, and they're harder and harder to find. And talk about controversy, you get into this debate about whether like different sources of salmon, and it gets really messy. I'm sure there are great sources out there, but that's a whole discussion into itself. I take fish oil, also have for many years. I plan to continue doing it. And so I'm grateful to hear that you do as well, because
we're both
you're the
on
expert.